we've been given these cue cards. I think this is for vibes, as the kids call it these days. And then we'll have a totally natural conversation with these cue cards. So you go first.
So number 1, the National Cancer Plan. As a cancer patient, how important was it for you to make sure this happens?
So we're going to be inundated with calls for strategies for everything. And I think for lots of major conditions, we will want to look at what can we do to improve the experience for this particular group of patients with this condition. But the reason why I'm kicking off with cancer isn't just because of my own lived experience, although cancer does hit me differently now, having been through it personally. It's also because I've always regarded cancer as the canary in the coal mine for the NHS.
Really?
If we're doing cancer care right, we're more likely to be doing everything else right. Not inevitably, but more likely. One thing I can say with certainty is if we're not doing cancer right, we're not doing anything right.
Yeah.
Because all the parts of that journey, from diagnosis to treatment to recovery, like that pathway, if you improve that for cancer patients, you're creating a rising tide that lifts all ships.
Yeah.
So given 1 in 2 of us are affected by cancer, and actually think about all of our friends and family, cancer is actually a universal experience.
Everyone knows
so we need
someone.
universal improvement,
Yeah, brilliant.
So I'm really excited as well, because the thing about this cancer strategy, it's not just going to be written by me, it's going to be written by all of us. We're going to get a whole world of cancer clinicians, the huge number of charities in this space, patient groups, families kind of involved in the design of it, so that it hopefully hits the right spot, both in terms of the ambition, but crucially the plan to actually deliver.
I love that you're getting the patient voice involved, because often we're not heard. And I love that we're saying our cancer rates aren't great compared to other countries. We could be doing so much better, and owning that, and hopefully making this a plan for the future that isn't changed, that isn't tampered with, because it affects us all.
Completely agree. And your point about other countries as well, that's the thing that I get frustrated by. You look at other comparable countries, I mean, we are seriously lagging.
I think we're 25 years behind, a recent report said, in some countries.
Yeah, and yet you look at our life sciences, our medical technology, we could be genuinely world leading. I mean, I know people get sick of hearing politicians say, we're going to be world leading in everything. We're probably not going to be world leading in everything, but
we can
have a good go in this, which brings me on to my cue card.
Okay.
AI in cancer.
Now, to me as a breast surgeon and a breast cancer patient, AI means aromatase inhibitor. And that's the drug I take to stop my cancer coming.
I'm a history graduate. I haven't got any idea what you just said.
It's a drug to stop you making estrogen. I think this is game changing. I was involved in AI reading mammograms quite a few years ago, and I think a lot of people don't realise breast screening mammograms are double read by 2 people to make sure they are accurate, that we don't miss anything. And AI can do the job of 1 radiologist. It can read thousands of mammograms in a day. It can free up radiologists, of which is a shortage, to save women's lives. And I think the Edith trial announced today is just fantastic. 700,000 women will have their mammograms as normal, but they're screened by AI. The results are quicker. It reduces that anxiety. The scanxiety.
Yeah.
And it will hopefully save lives. And I think this is a great stepping stone to start using AI to boost healthcare.
I agree. And the thing I love about this, I mean, firstly, from a patient perspective, I love the idea that I'll get the best of both worlds. I'll have a pair of human eyes on it, but I'll also have a clinician who is assisted by cutting edge technology, which means the likelihood of that something being missed is so much lower. But then, putting my health secretary hat on as well, thinking about making best use of our limited resources, we can double the capacity in this stretched workforce if we have AI co-pilots. So I'm really, really excited by the trial. 700,000 women, as you said, participating. Government backed, we've got the investment going in, centres right across the country. So fingers crossed it's a success, because I like you, I think this could be game changing.
I think it's going to be brilliant. So my next cue card, diagnosis. Now, we know anecdotally that 1 in 4 people find out they have cancer in A&E. And I'd love to know what it was like, because I give cancer news in a clinic. Private environment, mobile phone, there's someone there to hold the hand. What was it like being in A&E?
So my cancer was caught thanks to A&E. I wasn't given the diagnosis there. In fact, I sort of left A&E. So I'd gone in early that morning with really bad back pain that turned out to be kidney stones, my lucky kidney stones. And as I was getting ready to leave, they just sort of said, "Oh, you know, it's a bit like Columbo, or just one more thing."
Yeah.
So look, we've noticed something on your kidney, but look, given your age and your health, probably some fatty tissue or some blood vessels, all these sorts of things it could be. But we're just going to check it out. And I thought, wow, look, these, you know, despite the NHS being really stretched, like, they're so diligent.
You weren't worried at the time?
No.
Cancer wasn't even in the back of your mind?
No, I just thought, oh great, they're going to do a scan to work out what's going on. Had to wait a bit because the patient transport didn't get me from one hospital to the other because there was all these COVID restrictions. So that was frustrating. Then I ended up going for the wrong scan. So I was meant to go for a contrast use CT scan, went for an ultrasound instead, which wasn't the worst thing because that started to warm me up to cancer. It was the first time I Googled kidney cancer.
Really?
Was when the guy was doing, you know, the ultrasound, and I saw that kind of horrible kind of cool jelly on, is like kind of scanning me, and he was sort of providing a running commentary and sort of saying, well, it's definitely not blood vessels. It's definitely a solid lump, and he sort of said, I think he said something like, it's most probably benign.
Ooh.
And as soon as he said the word benign, my brain went straight to tumour and straight to cancer. And he said, look, probably nothing to worry about, but you need a contrast use CT scan. And I thought, okay, I think that's what they said I needed. But anyway, so I went off. And as I was waiting for my partner, I was Googling kidney cancer. And that was the first time I had this fear in the pit of my stomach that this could be cancer. And I started to worry for the first time. And then I was on it in terms of chasing that next appointment. And then I actually got, because again, with COVID restrictions, I got my diagnosis over the phone in a car park in Bury, where I was about to go campaigning for the local elections, and got this diagnosis over the phone. Took it quite well. I mean, I was joking with the guy who rang, because he said, he's like, you know, he gave me sort of, this is what's going to happen, and you know, having kidney removed. And then I sort of did a sort of summary back to him. So I said, so if I've understood this right, it's bad news because I'm relatively young and I've got cancer, so that's bad. But you caught it early. I'm going to have my kidney whipped out, but it's okay, I've got 2 of those and I need 1. So I'm quite lucky, really.
Yeah.
And he said, well, he was laughing down the other phone, saying, like, well, that's one way of looking at it. I said, well, if you excuse my language, I don't know if this is going to survive the cut, but you've delivered the sandwich rather well.
Yes.
And I got off the phone, opened the car, greeted my friends as if there was nothing going on, went out knocking on doors. And it's still online. There is a video of me that's like a selfie in the snow in Bury, out campaigning, where I'm doing this kind of video about my campaigning as if nothing is going on. And I looked at it and thought, you are a lunatic. What on earth were you doing? Like, you didn't tell anyone. I told my parents later that, and that's where it really hit me. And brilliantly, the nurse who'd listened into the call with the consultant, she followed up and phoned later to say, how are you feeling? Yeah. Do you have any questions? By that time, I had loads. I had my notepad, I had my pen ready.
Dr. Google.
And I was ready to start asking the serious questions about my cancer journey.
It's tough, isn't it? When that reality suddenly hits and you just think, am I going to be alive next year? And having to go through treatment during COVID, I feel lucky that I was diagnosed and had everything before COVID happened.
Yeah. It was, I think the hardest thing for me about treatment during COVID was not having family with me at crucial moments, like leaving my partner at the door when I was going in, not being on my own when I went in for the biopsy, which was way more painful than I expected. I mean, that was this tells you something about my addiction to elections. That was on the day before the local elections, the biopsy, and I told my local Labour Party. This point, I hadn't told people what was going through, but I said, "Oh, you know, I'm going. Don't worry, I'm not going to be there on poll. I'm not going to be there on either poll, so I've got to go to see the doctor. But I'll be there on polling day." And my partner's mum, who is an ex-nurse, was like, "Don't be so ridiculous. You're going to be in bed on polling day." And so it was. And tell me a bit about your experience.
So I'd had a couple of breast cysts, and I got out the shower and saw one on my cleavage, and I just thought it's another cyst. I'd had a normal mammogram 6 months before, and my mum said, go and get it checked out. Normal mammogram. I was seen by one of my old bosses, and I had an ultrasound, and a bit like you, she put the probe on my breast, and I saw a cancer. But because I'm a breast surgeon, I knew what that meant.
Yeah.
I knew I was 40, it was big. I knew I need chemo. I had a good idea what my odds of survival were. And it was like this light bulb switched off and I was just suddenly in denial. And 2 weeks later, I was in the chemo chair.
Wow.
And it was tough finding out just what patients go through and how hard it is.
But in some ways, I sort of think in some ways it's harder on you because before anyone's even had that conversation and walked you through it, you're straight there at like final destination. I know where this is going because of your experience. So
you're not drip fed. You know too much. And I had to decide how much of the information to tell my husband, who's a surgeon, and my parents. So my next cue card, life after cancer. Physical, mental, the collateral damage. What's it been and how can we help patients in the future?
Oh, this is a great question. It's definitely been life-changing for me and life-affirming. I went through that experience thinking it could have been so much worse. I'm still here. Am I doing the things that I really want to be doing with my life? And I'm very lucky. I mean, back then we were in opposition. I mean, I'm doing the best job I've ever had in my life and I suspect will ever have in my life. And it is a massive opportunity to give something back to save the NHS that saved my life. And it is that existential, I think, for the NHS. So that's been amazing. Cancer does hit me differently and it catches me unawares sometimes. Like we've had a kind of upbeat conversation about cancer, but there are other times I'm reading about someone's story or I'm having a conversation and suddenly I find myself welling up. And it hits you by surprise and you think, I've put this to rest now, that's behind me. And it's like a kind of silent stalker, it catches you unawares. So it definitely hits me differently. But there's life after cancer. I don't think the fear ever goes away. I had a lump the other year, which I went and got investigated. And actually, I was much more scared about that and much more scared about the unknown than I was after I got my cancer diagnosis, even when I was waiting for it. So I think that fear of cancer coming back never leaves you, actually, as a cancer survivor. It's almost like you're a cancer survivor for now.
Yeah, it's like you're cancer-free, but you're never free of cancer.
Yeah.
And I think if we can help people survive mental, physical side effects, we'll help people live with this chronic disease, which is what we hope it will become.
Yeah, and I think that's the other thing I'd say is, I don't think, because I've had a particular experience, I know it all. Yeah. And everyone's cancer experience is different. The pressures, the challenges, the extent to which people are mentally coping or not is different. And so I bring my experience to bear, but not thinking it's the only or the most important or the most valid experience, or it's how everyone else is experiencing it.
So important.
Yeah. This is a funny question to ask you because you're often, I suspect, dishing out advice. So what was the best advice you were given?
To exercise. Someone told me to walk for half an hour every day during chemo. It would reduce all the side effects.
Wow.
And I carried on and I went to the gym, and we now know there's evidence to show that exercise can reduce the risk of cancer coming back by 20 or 30%.
Wow.
It should be the first drug that doctors prescribe, and I'd love to see us getting on the exercise bandwagon.
It is the wonder drug. I mean, don't get me wrong. I mean, I'm a big fan of all these new treatments and technologies that are coming to play. But diet, nutrition, exercise, these are the wonder drugs, actually.
Yeah.
That's one thing that's changed for me since I had cancer. I now regularly go to the gym. Unfortunately, as I was saying to someone the other day when I was picking up a slice of cake at the counter in the Commons tea room, I don't know why I can't lose weight doing all this exercise. I mean, I'm doing all right on the exercise front. I've got some work to do in terms of my sugar addiction.
You're still allowed a bit of cake. It's all good.
Absolutely.
So Wes, I'm going to throw that back at you. What was the best piece of advice you were given?
So, my clinical nurse specialist was amazing. Mm-hmm. Like, he was available at the end of a phone or an email, so many things. The one thing I said to him, I wished I had known before I went home, was how difficult it was going to be getting in and out of my own bed as opposed to the hospital bed. So one of the hardest, such a weird thing to say, like, up against the cancer itself. But one of the things I found hard is when I got home, and I felt quite sore because I'd had the abdominal surgery. I'd gone up to bed, couldn't get in. And that was the point which I just burst into tears. I found it I just was overwhelmed by it. And the pain and the totally irrational risk that somehow my wounds were going to pop open, which
Yeah.
is never going to happen. And so, and I wish I could remember her name because I think she deserves loads of credit. My partner was Googling on YouTube, was looking for like some video or guidance as to how to get in and out of bed when you've had abdominal surgery. And we found, and I wish I could remember her name, an Australian clinician who was giving advice to women who'd had cesarean section. So I followed her advice for women who'd had a C-section to get in and out of bed using the same technique, and that was transformational for me.
We'll have to do a video.
Yeah, that was the best advice I got, and I must find her actually. She deserves that credit.
Brilliant.
Yeah, well, thanks so much for your time and
Thank
talking.
you.
And I really think throughout, our lifetimes, we're going to continue to see this revolution that, as you say, reduces cancer to being an everyday chronic condition that we need to manage and treat and cure.
Yeah, fingers crossed.
Thank you.
Thank you.